Okay, thank you very much. So thank you everybody for giving up your time to join the call today. I'm Sue-Jane O'Keefe, the Community Outreach Officer for Healthwatch Enfield, and I extend a very warm welcome to each and every one of you joining us today on this very rainy day. For those of you who don't already know Healthwatch Enfield, we're a community interest organisation providing a number of free services in Enfield. Signposting, which is a public health line, a one-stop shop for information about health and social care services in Enfield. Research, we engage with local communities through surveys and events to collect your views, opinions and experiences of using services in Enfield. We present this research to service providers and work with them to help improve and promote their services based on your feedback. So lockdown and the pandemic has taken a toll on all of our mental health. None of us could have predicted that a year ago, that we'd still be working from home, using Zoom and talking to a screen, and online platforms to engage with people. Our lives would be changed so dramatically. Parents have had to take on homeschooling as well as working and running a home. We've been unable to see loved ones or give them the hugs and kisses we so want and need to. And isolation and the lack of basic human contact has been an emotional drain. Concerns about jobs, income and general instability or uncertainty has caused huge anxiety too. And of course, a big one, the fear of getting ill and catching the virus. It all erodes at our confidence, our well-being and our stability. And this is why it's such a really important topic to cover. So today, we're talking about mental health and meeting some of the people who run different services in Enfield, finding about what they offer and about what future plans there are as services respond to different needs in the community as a result of the impact of the pandemic. Now, I should point out that these are the representatives from the organisations. They are not necessarily the person that can deal with you on a one-on-one basis. So if we do get questions around that, we have to give a more generalist response to you. And in fact, you may need to speak to your GP to get a more one-on-one detailed response. So I just need to mention that up front. So I'd like to introduce the experts and let them talk about a bit what they do. And we have a mix of GPs, managers, directors and chief executives from a range of services in Enfield, including Barnett, Enfield and Harrington Mental Health Trust, Mind in Enfield, a mental health charity, Enfield Carers Centre and Age UK Enfield. So we're going to let you know how the session is due to run today. We'll start with a very short introduction from each of our panel members. That takes about 20 minutes. Then we'll read out the questions you sent in to us at the time of booking, or you can ask them yourselves if you've opted to do so. And our panel members will ask questions according to their area of expertise if they can. If not, as I mentioned before, we will have to defer to going back to your GP for anything specific if you want additional one-on-one help. So this is a huge area, so if we have to, we'll get back to you afterwards, and we can always do some research on matters and tell you afterwards as well. And we're going to do our best to keep the conversation free from jargon, and please type in the chat box if anything is not clear, and we'll clarify as we go along. So any additional questions, please put in the chat box, and we'll try to get to those after the pre-submitted questions, if there is time. We do have over 20 questions though, so there may not be, so please bear that in mind. And in the meantime, I'd urge everyone to keep your speakers muted so that we can keep the background noise to an absolute minimum, and we plan to finish on time at 1:45 p.m. We'll send you out links or information about services by email after the call, with details of any services we discussed during the session. So let's begin. Enough of me. Let's speak to Dr. Mo Adhd, who's the Clinical Director of Mental Health Services for Barnett, Enfield and Harrington Mental Health Trust. Thank you, Mo. Over to you.
Thank you, Sue-Jane. Good afternoon, everyone. Welcome to the event. So, as Sue-Jane's mentioned, I'm local resident, local GP and Clinical Director of Enfield Community Services. So that's the physical health provider of community services, which sits alongside the mental health provider in an integrated trust known as Barnett, Enfield and Harrington Mental Health Trust. And I've got colleagues from our mental health division and our exec team here to help us all. So hopefully we can provide a holistic and integrated view of services. Thank you for asking me to come today, and I hope you enjoy the event.
Thank you very much, Mo. I'd now like to introduce Dr. Adhd Grewell, who is the Clinical Director for Enfield Mental Health Services. Thank you, Dr. Grewell.
Thanks so much for inviting me. Hello, everyone. So I'm Adhd. I'm a consultant psychiatrist by training, and I'm Clinical Director for Enfield Mental Health. So Enfield Mental Health is part of Barnett, Enfield and Harrington Mental Health Trust. And what we are trying to offer our population in Enfield is the area that I cover are the inpatients who have got severe mental health problems, those who are managed with community mental health teams, and those who have contact with our crisis teams as well. And in addition, I also look after the services for older people, including for dementia care and also CAMS. So I've got quite a busy job. I know Enfield pretty well. I've worked on and off in the borough for probably around about 15 or 20 years.
Thank you so much, Adhd. We're going to go on now to Fiona Myers, please, who is the Interim Managing Director of Bonnet, Enfield and Harrington Mental Health Trust. Thank you, Fiona.
Thank you very much. Good afternoon, everybody. As I've been introduced, my name's Fiona. I've been working at the Trust for the last 5 months, covering the Managing Director role, working very closely with Pardeep, and together we manage all of the service delivery for mental health for Enfield. Thank you. I have got a clinical background, so it's a sort of joint role really from a clinical perspective as well as a managerial perspective.
Thank you very much, Fiona, appreciate that. And on to Andrew Wright, who's the Director of Planning and Partnership at the Bonnet and Enfield and Harrington Mental Health Trust. Thank you, Andrew.
Thank you, Sue Jane, and thank you again for inviting us. I know a number of people on the call, and I certainly know a number of Health Watch colleagues. I've been at the Trust about 13 years now. I am an Enfield resident. I live in Enfield town as well. I guess my role is really about managing across the whole organisation, working with all of our clinical teams, helping to coordinate our planning for the future, and also linking with our external partners. So hopefully I can answer some of the wider questions that are about our trust-wide services.
Thank you very much, Andrew. And on to Alex Tamborides, who's the Chief Officer for Mind in Enfield. Thank you, Alex.
Hi, hello everyone. Thanks for inviting me to do this, and to everyone that's come to listen today. I'm the Chief Executive of Mind in Enfield, and I'm not currently a resident, but I was born in Edmonton 47 years ago. Mind in Enfield does 3 things. We do therapy, well-being and advocacy, and very much we work alongside the Trust, focusing mainly on what some of us call the social determinants of mental health. There you go. Lovely to meet you all.
That's great. Thank you, Alex. And on to Alison Gordon, who is from AGK Enfield and is Head of Prevention Services. Thank you, Alison, and welcome on board.
Hi, Sue. Thanks very much. Thank you, everyone, for coming today, and thank you for inviting us to be part. I'm Alison Gordon. I'm Head of Prevention Services at AGK Enfield. We offer services and support to people over 50 who are residents of Enfield in numerous ways, countless ways, from Front Door, which is offering information and advice about a range of services, to health and wellbeing with Fit for Life classes, exercise, digital inclusion, and then to directly provided care services and specialist care services at the end of our offers. So we're here to support anybody who's a local resident in any way we can. We work very closely with our statutory organisations and VCS partners in Enfield and any grassroots organisations.
Thank you, Alison. That's great. We do have one more speaker, which is Mark Warwick. I believe he may be a little bit delayed, but I can introduce him anyway on his behalf in advance. I work very closely with Mark actually at Enfield Carer Centre. He's the healthcare support manager, and they run a whole variety of support services, including the, like you said, one-off information, and they have these sessions online, and hopefully they're going to get back to face-to-face when they can be allowed, like a lot of us. I'm sure that's something we're all looking forward to very much. So when Mark comes back online, we will reintroduce him and let him know that so you see the face before the name. So we have a number, like I said, of pre-submitted questions. Do you link with the social prescribing network, and are patients being referred to other charities that offer support via support groups and befriending, for example? And that's kind of a wider question. Whoever would like to answer that, I know that Alison, you work with social prescribers, perhaps you would be a useful person to speak to about that, please.
Yeah, happily I'll answer that. So within Enfield, we developed a social prescribing peer support network for actual link workers, GP link workers, and anybody who works in navigation roles within DCS. And so we all talk together. We all try to come together, and we pick up referrals, we discuss cases, we always look at continuous ways of working. So I think the answer to that is that as link workers, everybody's always reaching out into all the other organisations. So yes, we'll accept referrals from anybody, and we connect to everybody. And if there's somebody who's not part of our steering group, we'll always invite them to be part of it. And they follow very strict rules of best practice, and looking at best offers and looking at different ways and gaps in services. So if there's something missing that which we're not offering, we always work together for that as well. So in brief, yes, we do work in social prescribing ways for people that are affected by mental health, and we connect back as much as possible.
Yes, thank you, Alison. I believe they also work in some GP surgeries and clinics, and prior to COVID-19, of course, but still working with those organisations to take referrals. So there's very much a very still active service. And there's also a branch of that within the Carers Centre also. So there's quite a wide breadth of help and support out there. You just need to ask for it. So going on to the next question, we have Jessica Bunn from the EVA who'd like me to ask on her behalf. And this question is, what are the most common or the primary mental health issues experienced by adults in Enfield? That's a very broad question, but anybody like to come in on that one, please?
I can do that. So, Fiona Myers here. Over the past year, the most common problems we've seen in our IAP services are depression, generalised anxiety, trauma. And for older people, this is depression, failing health, aspects of increasing social isolation, and bereavement are the main factors in influencing this.
Thank you, that's really useful to know. And how does funding for mental health filter in specific priorities associated with this? Is Andrew, is that something you can help with?
I can give an overview of that. Obviously, funding comes from the government. It comes to what's called the Clinical Commissioning Group, and in this part of London, we have one for North Central London, which includes Enfield, but also Barnett and Harrington and Camden and Islington. And some of that funding goes to our colleagues in primary care, and some of that is then used to fund some of the voluntary organisations as well. But I guess the majority of it comes to us and our colleagues in Camden and Islington, and there's also another mental health trust in North Central London. It is based essentially on population size and population needs. So there is a national formula that allocates money. Within that, the CCG locally, in line with national policy, then allocates it into different areas. So the national policy determines how much is spent, for example, on hospitals versus mental health, versus primary care, versus community health services. Other really important point around mental health. So the government in the last 2 years has been very clear that they are increasing investment in mental health services across the whole of the NHS. And locally, we've got quite a significant increase in funding to develop our community mental health services, which Pardeep talked about, so supporting people in their own homes to not need to come into a bed, also supporting our crisis services and developing what we call crisis houses and crisis cafes. So that is quite significant, and we're increasing the numbers of staff and the range of staff in our community teams and in our crisis services. So there is a good news story, although obviously, as you'd expect us to say, we very strongly believe more funding does need to come into mental health, and obviously part of our role is working with colleagues to make that case and to argue for more resources to come to mental health locally.
Alex, I think you wanted to say something.
Yes, that's me. I completely agree. In terms of from a general practice perspective, just coming back to presentations, those are the top three. But I would say also mention that physical health issues are masked by mental health issues and vice versa. So that all leads to delayed presentation, and we've had lots of problems around delayed diagnosis. So it's urging patients, citizens, and through their communities to attend. There is a service, GPs that are open for business. You can call them. They're now slowly starting to see patients face to face, and that's been another issue because we haven't been able to get the numbers of patients that we would have liked to be seen face to face, especially those with chronic health issues. But I think that the message needs to get out that patients need to present in the first instance to their GPs. That's what they haven't been doing.
Thank you, Mark. I think there's a thing about people not wanting to bother their GPs, that there's a bigger crisis around them and they feel a bit like, oh, I don't want to waste people's time. And we've heard that again and again and again, where people are sort of, oh, I'll wait until the end of the pandemic. And unfortunately, that's not the message I know that you're trying to say, is actually go and get the help when you need it. Don't wait. Thank you, Mo. Yeah. And Alex, you wanted to add to that, please.
Yeah, it was just to add one thing about the most common mental health problems that are being presented, in that depression, although depression, anxiety and trauma were mentioned, depression and anxiety have always been the most common mental health problems since as long as anyone can remember. But what's new is that there's been a big increase in the general population, a really big increase in the population that we've not really ever seen before during COVID. Even in as early as sort of May in last year, the public health was reporting that it went up by 10%, and that was on a basis of 25% already. So it's even more important that, as Mohammed was saying, that people do go to their GPs, that do reach out for help. And part of that is breaking down the stigma and looking at it in terms of how you would get help if you did have a physical health issue. There's no shame in asking for help.
Thank you, Alex. That's great. And it kind of runs into the next question, which was prevention's better than treatment. And what do you think can be done by existing services, mental health and otherwise, to increase mental health outcomes before they get too damaging for individuals? I think we've touched on that already, in that they're trying to expand services. There is more out there. But is there anything else anyone would like to add to that at all? Alex?
One thing, it's a favourite topic of mine, just very quickly. The 5 ways to well-being. I think if more people knew about the 5 ways to well-being, it would be an incredibly sort of powerful thing for the residents of Enfield and beyond. So a bit like the 5 a day you're supposed to have for your fruit and veg, there are these 5 things that you can do every day which do aid recovery and prevent mental ill health. They're known, they're scientifically evidenced, and they are connecting with others, keeping active, so exercising, taking notice, which is about being present and doing activities which keep you in the present, keep learning, so doing things different and challenging the grey cells, and then finally give, which is basically sort of altruistic or compassionate behaviour. So those 5 things, and also treating your mental health like your physical health, would be a brilliant way to look at this more preventatively.
Thank you, Alex. That's fantastic. Next question is about a 45-year-old who suffers from forgetfulness and confusion, which affects her everyday life and work performance. She's had tests and the MRI comes out clear and there's no signs of dementia. So how does one juggle everything? And it's quite a big struggle, and positivity and determination is needed to be greater too. There's basically a lot of help and support needed here. And I would suggest, obviously, like we mentioned earlier, if there are any particular real issues, you do need to speak to your healthcare professionals, your GPs. Would anyone else like to add to this at all?
I can, Sue. So look, this is the general principles here is that, you know, we get individuals who are young, 45 is young in my book, who are suffering from problems that are usually associated with older age. And so, so this is an unusual situation generally. And as Mo says, we do normally, we'll ask people to go to their GP first, but here it looks like that person's already been to the GP because they've then been to a neurologist, and the neurologist has said, well, I don't know what to do. And so what we would generally advise in this situation is to remind ourselves that forgetfulness and memory problems can be related to physical health issues like dementia, but also mental health issues like depression and anxiety, and also alcohol and substance misuse issues like alcohol misuse. So if that is still an issue, having seen a neurologist, then it might be a good step to go back to the GP, have a fresh look at what else is going on, and if it might need a specialist opinion from a psychiatrist, now would be a good time to do that referral.
Thank you. Anybody else want to add to that? I mean, from a personal perspective, I have to say, the menopause made me really forgetful. And you know, I lost my words and so on and so forth. So that could be a contributory factor as well. I don't know, but if that person goes back to their GP and looks at a more holistic approach, the whole person, they might be able to try and narrow it down a bit. So I hope that's helpful. And we have a question about ensuring the voices of people who have mental health and their carers are heard and acted upon. How are you adapting and developing services? Now, you've mentioned some of this already to some extent, but how would you answer that particular question about adapting and developing services so people's voices are heard and that their needs are addressed? Anyone like to answer that? Alex, thank you.
So I think that the voice of people with lived experience is incredibly important, whether it's the people themselves experiencing mental health problems or carers who are often caught in between a rock and a hard place in this. Most of the charities and also the trust do have existing sort of good practice around involving the voices of service users in designing and developing their services. So we all regularly collect feedback and views from people, but I do think we need to go further than that. And I think what I'm hoping is that there's going to be some resource put into this area to actually support people with lived experience to get more involved in the design and development of services as we go forward. It does need to happen, in my view.
Thank you, Alex. And also, Healthwatch Enfield is there for that very point, is to hear your voice and to actually acknowledge your thoughts and feelings and what's going on with health and social care services. So please, if you have particular issues or experiences you want to share with us, please get in touch as well.
Perhaps can I just add a bit from
Andrew, yes?
Yes, sorry, just from the trust perspective, just to sort of follow on from what Alex says, obviously we've got a whole structure to engage with service users and their carers and families. We employ now a number of former and current service users as peer support workers and experts by experience, which is a really valuable means of getting input. And we've got a number of events. So we've got an event next week where we're engaging with a whole range of external partners, but including some service users and carers around what are our quality priorities, what are the priorities for our services for the next 12 months, have been invited. So there's lots of different ways, both sort of individuals, but also across the organisation of getting voices. But undoubtedly, we need to use them all, and there's still more we can do.
Thank you. Yes, we've had a couple of questions around about private and hidden phone numbers as well, a communication issue, which you may not be able to answer right now, but it's basically about people, especially autistic people or people with anxiety and certain traumas who get quite anxious when you get an unknown phone call coming into you, whether it's from your GP or whoever. Obviously, there a lot of departments do that where it's an unknown number. And how do you actually put in place where their contact preferences are respected? Is that something we can answer today or something we need to defer? Anyone able to help with that?
So we're moving towards that in general practice, Sue. So patients are aware of a named number from the practices, and so that they can identify with that in terms of contact details and stuff. So it's becoming much more sophisticated in terms of our communication systems. Can I just come back to the point? I was going to mention our Expert by Experience program. It's an excellent program. So, you know, we involve patients and carers in co-producing our services. I think that it's pertinent here to mention that the whole North Central London system and our local systems moving towards integration. So that's integration of mental and physical health for patients. And I think you can't address one without the other. I mean, we know that patients with mental illness die on average 15 to 20 years earlier and have nearly a 4 times higher death rate for people, especially under 75s, and major causes of death are from long-term conditions like asthma, COPD, diabetes, etc. And I think that it's encouraging that the system is moving towards a more integrated way in developing services. So involving patients, involving carers, but addressing physical and mental health needs of patients, which is really important. And I think that BEH, so we're not blowing our trumpet, but it's a fact, you know, we're in pole position to do that, actually. We've got a mental and physical health arm. And that's something that I was brought to the organisation to help along with, and my colleagues Pardeep and the clinical directors team and the mental and physical health divisions are coming together to co-produce those services along with our service users. So it's very encouraging.
Thank you. And what support should someone expect if they don't meet the criteria to be sectioned, but are having suicidal thoughts and need immediate help?
So can I just go back? I'm worried we missed Tony wanted to say something, and I've got a hand up with Nusrat. Can we just go back to them?
We have to. I'm only on question 6. That's the only point. So we're going to lose the questions we've already put into the system. So we can always come back to individuals afterwards if that's okay. But we do need to prioritise the questions that we've had posed to us originally.
Fine.
Okay.
Well, that leads me on neatly to this one then, doesn't it? Which is probably for me. So this is about people who are really acutely unwell, who are mentally displaying symptoms that are worrying for families, and the families think, well, this person probably needs to be in hospital. And the decision about hospital can be one that provides different opinions. We're allowed to have different opinions on who should and shouldn't be in hospital, because that's how the process of sectioning works. Sometimes it's clear they need to be in, sometimes it's clear they don't need to be in. Occasionally, there are these situations where we're not quite sure. And in those situations, we need to make sure that those individuals have got a decent level of care while they're at home or with their families. And that's normally done by our crisis resolution and home treatment teams. So they will then provide what is the next best option. Essentially, it's a bit like a mini ward on wheels that will support them at home, and they'll keep an eye on them, see whether they can improve the situation so they can then be managed happily at home or with a community mental health team. Or if things get worse, then they'll flag it up and they'll revisit this decision about admission and sectioning. So either way, they'll be looked after and monitored.
Thank you. And of course, there are the other immediate services like the Samaritans and other organisations that can give support and help, and you can talk to as well. Alex, is it worth mentioning the Sanctuary project at this point?
Yeah, I mean, so Enfield CCG has been great in that they've actually funded, we have a service that's been funded in Enfield, quite an innovative service called Sanctuary, which is basically an online at the moment. So it's just telephone and online service for residents that are in distress. And it runs actually from between 12 midday up till I think 10 in the evening. And for anyone that's really feeling that they just need to talk to somebody, just right there and then, you can call us and we'll be able to help. Now, and what we'll also do sort of uniquely with this service is we can then follow up the very next day with one-to-one support to actually address what might be the underlying sort of reasons for your distress. But I have to say, we are running this service in very close partnership with the service that Pardeep was just talking about, CHRT, because actually for people that really do need more of a clinical intervention, then absolutely we would be working with CHRT to provide them with that clinical input, because so we work closely together in that way.
That's great. Thank you. We put the link
service in the chat.
We put the link in our chat for any of those people that are interested in the Sanctuary project as well, because that's a really useful one to know about. The next question is, I'm a single parent and have struggled with lockdown, homeschooling and trying to maintain my job and my home, but I'm scared to ask for help in case I think I'm a bad parent and could take my child away. What confidential help can I get? And we may have covered that, but anyone like to just give another overview? Alex, thank you.
We'll help. Come to us. We'll help. And don't. Being a parent myself, and also someone that's got lived experience of mental health problems as well, I know exactly where that person is coming from. There's no shame in it at all. You need to, reach out for help. It's not going to lead to the. I'm just imagining the potentially catastrophic situation you have in your mind. You need to get help for yourself. It's a hard job combining all of that and yourself, and there is help out there. So we will be able to help, or actually the social prescription service that Alison's talking about will also be able to help, because one thing is that there are lots and lots and lots of services in Enfield, as there are in any borough. So yeah, reach out.
Thank you, Alex. That's really good advice. And I think that there's a big fear is about looking as if you're failing. And I think lots of people do have concerns around that, whether it's their job, whether it's, in their personal life and so on. That's a big anxiety. How many Black and ethnic minority people use mental health service? And how many Black, Caribbean, African people use the service? It's the same kind of question. And how many young people under 25 use the service? Do we have those statistics, or is it something we need to come back to?
I mean, we need to come back to it for the trust, but we also need to know which service we're talking about, because it's disproportionate or asymmetrical about the use of services from BAME populations and also across the borough, which as we know, has a different demographic between East and West, but really happy to try and provide that information if it comes to us.
That's useful. Thank you very much, Pardeep. And this is again about statistics, about people with mental health needs. Do we have current statistics in Enfield for numbers and about ethnicity numbers? So perhaps we need to come back to you about that as well, unless you have the number for mental health generally. Is there such a number available?
Andrew, sorry, I just want to come in, I think, but this is usually a question for our public health colleagues.
Yeah, I was going to say that, Buddy, yeah.
Who do an excellent job at trying to understand what the population need is. And they do a good needs analysis around that, and also looking at areas of Enfield where that might be higher and why that might be. So that could be a question that we could ask them to come back to.
Stuart Lyons at the council has most of that information. There is a sort of a fairly standard set of information on population health needs in the borough, including mental health. So Stuart or one of the public health team could definitely provide that.
And what we have found is we've found a lot of people have had not had mental health issues before, and suddenly they're now coming forward asking for help as a result of everything that's been going on recently. So, you know, the statistics may be shifting anyway in that case. Next question. This is linked to the other one, I think, is that are there any mental health services for young BAME people, Black and minority ethnic people in Enfield, Bonnet and Harrington? Are there any mental health services for this group specifically?
I mean, I have asked this question internally for, sorry, it's me, it's Pardeep. I've asked that question internally for the trust, but so I haven't yet got an answer. I'm unaware of any such trust offer, but there might be something else in the community that I don't know about.
Alex, would you like to add to that, please? Thank you.
Yeah, there is a service that we work in partnership with called Wellbeing Connect. They do work with the BAME, more specifically with Black members of the community of different backgrounds. So they are a specialist mental health and BAME our charity. As I say, specialised in mental health, and there are a couple of others that focus on different ethnic groups. So Alpha Care, for example, offers services. It's got quite a big focus on providing services to the Cypriot community, and so there are a few sort of charities around there doing this work. Yeah, but I think more capacity. Everyone would agree that more support in this area is needed.
Absolutely. We actually did a report on Black and minority ethnic people and the impact of COVID on that community. So that might be something that people might want to have a look at our website as well, because that was quite an interesting response. And the next question is, I'm becoming scared of going outdoors and nervous about potential crowds and people around me. It's only happened since the pandemic and I don't want people to think I'm silly. What can I do? Anyone like to answer that one?
Well, I can come in there. So look, just to first of all, you're not silly. This is a problem that's experienced by many people, probably made worse because of the anxiety related to lockdown, not just for adults, but also for older adults and children. So the first port of call might be your GP, or it may actually be going directly or via your GP to the IAP service, which is well designed to have interventions that are quite simple and can run across for between 4 weeks and 12 weeks to help manage those symptoms and get you out and feeling happier. I'll put in the chat box a link to IAPT, which is improving access to psychological therapies.
Thank you, Pardeep, appreciate that. And then we have, I have never asked for help with my mental health and don't know where to start. There's a lot of information online, but I want to speak to a real person. I can't talk to friends or family about this. It's not a physical issue, so I'm not sure if my GP can help. Anyone want to answer this one? We've covered it in some parts, but perhaps Mo, you'd like to answer that, please?
Yeah, I mean, first port of call is that person's GP. You know, as I mentioned previously, we're open. We're contrary to popular belief, we are open. We have, you know, telephone lines open, and we are seeing patients face to face. So please contact us.
Thank you. And Alex?
I mean, the other thing you can do, I mean, Mohammed's right, is that actually we always say first port of call is your GP, but for some people that are sort of are concerned about, in quotes, going on record about this, you know, engaging with public health services, I can understand. that's one of the reasons why Mind is there. So you can come to us as well. If you reach out directly to us and you haven't spoken to your GP, it's likely that at some point we will advise you to go to your GP. So I'm not. As I say, I think contacting your GP is absolutely the right thing to do. If you've got concerns about that, you can reach out to us. But all roads don't need to roam in this case. They lead to your GP.
Thank you. I think there's a bit of a fear, isn't there, still in that whole stigma thing about mental health. I think that's why people are a bit nervous or anxious about doing it and don't want to sort of put their head above the parapet about it, but they do want to speak to someone. I think it's really important that they do. So absolutely speak to places like Mind and your GP, do both, get all the help and support you can get. The next question is, I'm interested in looking into mindfulness and ways to calm my mind, as I've not been sleeping well and worry a lot. My partner thinks this is a waste of time and tells me to get a grip. As we have a joint account and some of the apps and the services cost, I need to find free help. Are there any that I can access? And Alex again, thank you.
Sorry, I know I keep talking, but so firstly, categorically, your partner is wrong. Okay, it is scientifically evidenced to be, and it's recommended by NICE that mindfulness is a treatment for depression. And all of the evidence shows that it's actually good for mental health in all sorts of ways. That's the first thing. I'm not urging you to get into a conversation or argument about that. There is an app that you can use, that I use because I meditate every morning. There's an app called Insight Timer. An Insight Timer is free on iPhone or Android, and it's got thousands of guided meditation talks on it and a timer, and you can monitor your progress with it as well, a bit like a Fitbit. So that would be a really good thing to do. And start small. Start 5 minutes and then work your way up from there. If you try and go in for something like 20, you'll probably hate it and stop and give up. So start small and then just work your way up.
Thank you, Alex. And I think it's also about giving yourself that space to actually nurture yourself, and that's perfectly okay. And we need to do that during these challenging times. So it's good that you've actually reached out to get that help and support. And Alison, you'd like to add to that?
I was just going to also add there's lots of the DCS organisations in the borough that are offering meditation, mindfulness, relaxation, seated yoga, different activities which really promote well-being, and they'll be free. So reach out to us as well, and we'll be able to direct you. Any of the social prescribing link workers will be able to direct you as well. So it's just worth coming back to, because then you might be able to meet somebody else and connect to them too.
That's great, thank you. And anyone else to add to that, or are we happy to move on to the next question?
I just wanted to add one thing, which is that I'm also a mindfulness practitioner. So I like to use mindfulness and share what I know about it. But I know that mindfulness, I put in the chat some free access points for mindfulness, but they're all online. And I think there is a difference between an online access to things like mindfulness versus the face-to-face group. And I know we're hoping for groups to open up, but I do think that once that happens, I expect that'd be a great time to reach out and have that physical contact of doing something collectively. So my sense is it probably has a bit more impact.
Okay, thank you.
Just want to give a 30-minute timer warning at the end of the session.
Thank you, Claire. Okay, and online support is helpful during lockdown, and it'll be useful to get back to face-to-face consultations. Is this going to be available in the future when we come out of lockdown? I think we've all alluded to that we can't wait really to get to that situation. But I think it'd be useful to hear from the panel as to what their thoughts are on this.
Well, for the Trust, I can tell you that we're trying to extract all the good stuff from the pandemic, and the move to digital has been one of the good things. But we don't want to go too far that way, because we do know that some people either cannot or do not want to do things remotely. And so we are currently in the process of trying to understand from people who access our services what they best need. We think we know what they need. We haven't really asked them yet. And so the balance has yet to be found. And I think the balance will be different in different areas of healthcare. So, for example, it could be that the IAP psychology service might be a bit more of a digital offer than, let's say, the crisis team, which needs to be much more face-to-face and urgent. And that's an obvious two extremes, and with lots of things in between.
Fantastic. And we've also had a response in the chat room about a charity called Enfield Asian Welfare Association that also runs online services for free. Just flagging that up as well, which might be useful to let people know about, because there's a lot going in the chat at the moment, so you might have to keep a close eye onto that. And Mo, did you want to add something?
So I just wanted to say that, just building on what Pardeep has just said, so from a general practice perspective, the message to patients is that we don't think that we will ever get back to the previous way of working, and we don't think we should, because we've now developed virtual working in quite a sophisticated way, and we're still learning, but it's going to be very much about getting our vulnerable patients, so that includes patients in that list will be patients with mental illness, but vulnerable patients coming back in a safe way in the first instance. So it's about cohorting our patients, risks stratifying them, so according to high risk patients first, and getting them back safely. And I think that's a message that we'd like Health Watch and other partner organisations to get out there, that actually a large number of patients can be seen virtually.
Okay, thank you, Mo. There's a question about waiting to get mental health support and the delays. Is there anything that can be done through GP surgeries with specialist GPs so that help could be done more quickly? Because I think there has been a question where people have said that there's, in large practices, there'll be a number of different doctors. You may not see the same one each time, so you then have to relay your story, which may be a bit painful to you, to each and every single different doctor. Is there any possibility of a specialist GP that specialises in that area? Is that something that's available?
So I think we've tried this before. I'm not sure. So with varying results, and we have now resource in GP practices locally with mental health link workers who have a certain area of expertise around managing patients with complex problems and keeping patients in the community, helping them not to tip into crisis, especially. In terms of choice of GP, so the general rule of thumb is that you can see your GP of choice, but you may have to wait a little longer. And that's, maybe a week longer than usual, but absolutely, I think it's incumbent upon GPs to make sure that you have a named practitioner for our vulnerable patients, and that's something that we are trying to do. But yeah, we've got mental health link workers. I'm not sure about specialist GPs with a special interest in mental health. It doesn't seem to have worked in the past. My colleagues in mental health may want to comment on that.
Alex, you first and I'll come in.
Yeah, I think that what's happening, I think there's a really good direction of travel that's happening within mental health, which is going to see more expertise from the VCS and the trust, I think, centering around GPs. So we can't say specifically what that's going to look like, but there's going to be more support in that area. And I just wanted to build on just one thing that Mohammed was saying about this kind of whether, services that are online and offline. And I think that the really lovely thing that's happened, or the opportunity that we've got, is that we can now be much more person-centered about the way that we provide services now. So for some people, the idea of getting on a bus and going to see somebody about their mental health, traveling 45 minutes, they don't want to do that. So they don't have to now, which is brilliant. But for other people, for a therapy session, for example, where you can't do it at home for confidentiality reasons, because it could be about your partner, or you don't want to speak, in regards to stuff to do with your children or whatever, then actually, yes, you'd be able to use services in a building, in with privacy. And so the future is going to be blended, basically, and I think more person-centred, which is a really good thing.
That's great, thank you, Alex. And about people with dementia and those caring for them, what support is available to them? I know the Carer Centre do have dementia groups, and of course there's the fabulous Enfield Dementia Action Alliance that I know there's a representative here from. But what else is there available to help people with dementia and those caring for them? Alison, would you like to answer that one, please?
Thank you. So we offer support for people who are newly diagnosed with dementia, and we work very closely with Enfield Memory Service. So we have navigators who work with people that are just recently diagnosed, and we offer support that way. We connect to all the other services. We offer a memory service itself, a memory club, which is a fortnightly on Zoom at the moment, which is normally weekly in person. And we're starting to have tentative steps about returning to our in-person services. We obviously connect to our own in-house services like the Parker Centre, and the Parker Centre is a specialist dementia service for people with a little bit more advanced dementia. And when we're operating in person, we also offer CST, which is cognitive stimulation therapy. And we looked at activities for people at home as we developed postal packs, the memory care packs. So there's lots of activities that we promote for people specifically that way. But we've also got general services too, the Fit for Life services, the walks, the craft alongs. There's lots of activities that we provide which are dementia friendly, the social sing along. We've got a whole programme. So if anyone's interested in anything like that, please just drop us an email.
Thank you. And asking about counsellors and waiting times for getting counsellor support. That's going to vary depending on the services, I'm guessing, isn't it? So who would like to just very quickly answer that one? Are there sort of long waiting times to get to see speaking therapies and so on?
So in Enfield, we have clear targets around trying to see people through the IAP service, and where there is a wait, and it can be a wait of up to 12 weeks, we try and manage that waiting list so we can bring forward people who are more unwell or urgent. That may have an effect, of course, of people who are less severe, but it's something that we probably need to improve on, because we are expecting an increased number of referrals. It has gone down, interestingly, during some of the lockdowns, but I think a lot of us are expecting a sort of a surge of presentations over the next period, going through the summer, depending on what happens. And so we're gearing ourselves up for that so we can manage our waiting lists.
That's great, thank you. We've now got a couple of questions that are about younger people, which is not what this particular session was about. We may not have people who want to help this, but there was one in particular around young people worried about losing social skills because they've not been mixing with their friends in the way they did before, and lost confidence in themselves, and have got real anxiety about their studies and a whole load of other things. Anything we could do to offer some guidance there at all? I mean, we do have the event details that we had previously about children and young people that we can look at and look at the video, but anything extra we can add to that at all? No? Okay, well, let's move on. There was a question around new services that have happened. I know that we've mentioned that, we've touched on that already. We've had the Sanctuary Project, and that there's AGK's wellbeing work that's been going on and expanded. Any new services that have happened other than that we're aware of in Enfield? And Alex, would you like to go and explain that, please?
There's one which is a bereavement response service for COVID that Mind runs in partnership with the CAB, Citizens Advice Bureau, and so that's purely for people that have experienced loss as a result of COVID, and you're able to get access to counselling pretty quickly, actually, and also wraparound social support from the CAB. And we're thinking that this is going to be sort of extended now, hopefully until the end of this calendar year.
That's great, thank you very much. Excellent. Just want to check, Claire, have we covered everything so far? Have I missed anything? Just want to make sure we've answered all the questions so far regards to the pre-questions that we can answer at the moment.
I just add something in there? Mark's not here, so I just wanted to add that there's this new service that Enfield carers have for counselling for carers, and Alpha Care as well. During the COVID pandemic, developed or expanded upon their counselling services for members of the Cypriot community too. So I'll put them in the chat box as well.
That's great, Alison. I think there's a lot of help out there. Sometimes it's not just not knowing where to start or where to go for that help, isn't it? I think this is why this sort of event is really important, to at least help signpost people and put them in the right direction, if nothing else.
There was a couple of questions. I think you already covered about specific services for people with learning difficulties and autism, and then there was a question around if there was a supported accommodation for people over 18 with mental health. And if there were any new services. Again, I think you've covered all of those. And then there was one last one that came in. Any information that you have about support for adults with ADHD? Just a general question. Somebody sent in a personal question, but obviously you're not answering specific cases at the moment in a public forum. But was there any general information that we have to hand? If not, we can get back to that person individually.
I think Mo might be able to help me about the presentations to primary care, but within the Mental Health Trust, we have a referral pathway that is agreed across our section of North London, so we can refer people for assessments for ADHD to the service that's based in Barnett and run by my colleague, Dr. Muller, or Ulrich Muller. So that's for people who are referred into us for that primary assessment. We send them on.
Thank you. And do we know anything about supported accommodation in Enfield for those over 18 with mental health? Is there any such service?
So I think, Sue Jane, so there are a number of resources that patients and citizens can refer to in terms of Children's Portal, Young People Carers Centre, the Couth Counselling app. You know, there are a number of really good resources that they can tap into to get that information. We don't have it here, but it can be found.
Okay, that's lovely.
For the Mental Health Trust, there is so we commission and providers offer a range of supported accommodation for people with severe mental health problems, severe and complicated, where they really do need to have that level of care, and they're not able to manage independently. But that will be managed again through the mental health pathway, and only after proper consideration is made for treatment, because of course we want to make sure people are treated not just medically but socially and psychologically, and so they can try and manage without that level of support.
That's great, thank you. I think there's an intrinsic link between mental health and physical health in many ways. You know, if you're feeling low, you've got very low mood, it can actually affect your physical health. You're not looking after yourself as well. So it's about the whole person, isn't it, in many, many ways.
Perhaps, CJ, it's also worth highlighting our links with our colleagues in social care and children's services in the council as well. So for some people, they also need that social support that the council provide as well.
Mm-hmm. Okay, that's great, thank you. So I believe we've answered all the original questions now. So Claire, can you help me with any chat box questions we need to answer?
Yeah, we said that we would go to Tony, who had his hand up several times as
Sorry,
the first port of call. So over to you.
We weren't ignoring you, Tony, I promise. I can see you fluffing away, but the floor is yours, Tony. What would you like to ask?
Come off mute.
Yeah, thank you. I'll have to break it down a little bit because a lot of the things that, first of all, I'm so pleased to be on this call because there's so much I want to say in terms of the relevance of the people on this call and how it relates to what I do. So just quickly, I'm a former gambling addict, lost £500,000 to gambling addiction over a 20-year period, 9 years of that as a professional footballer. Now, I've been working with the Gambling Commission for 9 months, and one of the things that keeps coming up, which is a big part of gambling addiction, which I think majority of people, I would say, without being too rude, are not necessarily aware of the major links between gambling addiction and mental health, and particularly suicide. So, you know, there's a question that I want to ask to you know, the GPs on the call shortly, but just I just want to give you a couple of pointers. So all gambling associated with risk of harm, and anyone can be harmed. So we're talking about age, gender, status, background. It's absolutely irrelevant. So regardless of whether it's a footballer or not, we've got, you know, university students dropping out of university, blowing their student grant loans, etc. So this is massive. 1 in 4 people who suffer gambling or started suffering significant harm. 20% of the UK population is affected by gambling harm. We've also got approximately 500,000 people in the UK that are gambling addicts. So when we look at a bigger picture in terms of mental health, 2 people every day attempt to commit suicide. We had 650 gambling related deaths last year. Yeah, so if there's anyone on the call that feels that gambling addiction awareness and education services should be more prominent within the borough, and for the GPs, do you feel that, because we've had talks with consultation with the Gambling Commission, and they're saying that GPs in general are not aware or educated on gambling addiction.
Alison, thank you.
I think you'd be an excellent speaker at the Social Prescribing Network meeting, because we invite you along to that, because then you'll get to meet all the social prescribing link workers in the borough who then sit within the GP practices. You can influence back again that way, but also they receive all the referrals from the GPs, so it's a two-way thing. So, you know, just email me at the end and I'll get you connected into that.
Yeah, will do, Alison.
And Alex, you wanted to say something?
I think we Minds in Enfield will be interested in linking up with you, because the links between gambling addiction and mental health are clear. And also, my understanding is, I'm not an expert in the area, but it has gone up like massively during the lockdown.
Exactly.
So
yes.
Greater need than ever.
Yeah, I just want to touch upon what Alex has just said, because we've done some research yesterday. There was a research published yesterday that there's a massive increase during the pandemic of online gambling. So yeah, it's out there. The research, the figures are out there, and it's absolutely huge.
Well, thank you, Tony. You've got some great leads there now, so hopefully you'll make some great networking, which would be fantastic. I've just got one more question that I'd like to pose to the panel that's just come into me, which is, there's lots of money coming into the mental health. How do you make sure you're giving residents and patients what they need? What just do you think is best? Who would like to answer that very quickly, because we're running out of time?
Okay, I mean, I'm just about to write an email to some of my colleagues to ask whether it's okay to give a sneak preview, really. So there is a change in our services being planned, based around our NHS long-term plan, which is a national plan, but with our local needs considered. What that really means is that there's some new money coming in for us to really understand and enrich the mental health offer for people in Enfield, not just relying on our mental health experts, but looking at all of the providers and all the partners in our borough. And that means the voluntary sector, it means volunteers, it means peers, it also means the local authority, very importantly, and the mental health trust. So we are coming together, and we're meeting every 2 weeks to develop this idea, and I put a call out, if I may, to people who are interested in getting involved, because we need to what we call co-produce what we design. So we want to do it in collaboration with people who have used services or know about services and can help us. And there'll be different areas of delivery that we'll look at, and I think if we get it right at the beginning, it will have far greater impact. And so we're looking at getting this up and running over the next 2 to 3 months as the ideas start flowing, and then over the next 2 or 3 years, this new integrated package will be tweaked and shaped to something that's a final form.
So it's basically an opportunity for people to actually get involved in shaping this service. So now's the time. If you're interested, get in touch with Pandip. I think that's a really good opportunity. Well, we're running out of time now. I'm sorry to say that we could go on and on all afternoon. There's so many questions that we could actually be asking and answering. So HealthWatch Enfield is here very much for you. If you have any issues or you want to contact us, you know the number. We're going to put it in the contact list anyway for you, but do contact us. It's what we're there for. There's the information helpline, the email, all in the chat box. and join our mailing list. We can keep you up to date with all that's happening. It'll be verified, trusted information, no fake news here, so please do that. And if we said we're going to follow up with anybody, we will do so after this call. So thank you to everybody, absolutely thank you for giving your time today, to the amazing panel who's been honest and open with us. We really appreciate it. I know we haven't covered absolutely everything because it's not long enough. We don't have a long enough, but have a great afternoon. Thank you so much for coming, and I hope you all enjoyed it. Thank you so much. Take care and be kind to yourselves.